Hello, everyone. Welcome to another week's episode of Reconnecting the Dots, brought to you by Abdurrahman. Once again, I want to empower and help you to become the best version of yourself through this podcast, and I hope it benefits you. So take a listen to this week's episode and let me know what you think. So welcome to episode 15 of Reconnecting the Dots podcast. It's a program of the ITD talk show, and all thanks to God for another beautiful week. And thank you, all listeners, for joining us. I am pleased to be joined by an illustrious individual, a physician and a healthcare informatics professional with experience in clinical medicine, clinical research, pharmaceutical, and life sciences. She's currently the medical analytics director and insight lead for the U.S. medical affairs at GlaxoSmithKline, GSK. In her role, she explores data analytics and information from various sources to generate insights that support decision making and improve scientific engagement of patients. Please help welcome Dr. Bilikis Akindele. Dr. Bilikis, how are you doing today?
I am doing fine. Thank you so much.
And thank you for coming on the show, even though it's been very difficult to getting you on, but due to your busy schedule and all. But I'm glad you're on the show for it.
Yeah.
So without further ado, I would like to delve into the topic of the day and the episode, which is about the status of COVID-19. So it is indeed, a challenge that is known to everyone that a virus has ravaged the entire world, and specifically different nations across the globe, and which is COVID-19. So, Dr. Blix, I would like you to enlighten us regarding the status of COVID-19 right now.
Oh, thank you so much. First, before I begin, I will like to, just express my deep sympathies and support to everyone who is going through one challenge or the other at this point and may have lost loved ones to this pandemic. It has really been a huge constraint. It has a huge impact in our lives so far, and it's redirected our lives in so many ways that we don't even think that we might be able to think before now. It has required of us such an amount of energy and an amount of adaptability to even be able to get to this point. And so at this point, I am really, just sharing all of my love and my support with anyone who is going through a rough time as a result of the pandemic at this time. And I do send my sincere condolences to those who have lost loved ones during this period as well. I hope that they are able to find good memories of those loved ones to hold on to, and also be able to find the path to move forward in good health and staying well by themselves. So again, thank you so much for having me on the program. I'm so excited that we're able to get this on the books, even though it really
I am too.
Yeah. So you asked the question around what the state of COVID-19 is.
Yes.
As we might all, this is always in the news. It's in our faces every single time. It's no news that about 25 or even more than 25 million, I think the last time I checked online, it's been about 25 million plus people or cases have been reported. And that's the reported cases. Of course, there are so many people who have been infected by this virus so far that have not been symptomatic or have not been aware that they are actually infected with it. I think there's an estimate out there that it could be as high as 105 million people already infected, of which only 25 million is reported based on the testing that we're able to do. And in light of that as well, there's about 400,000 deaths or more than 400,000 deaths that have been recorded as well. And that's just thinking about the magnitude of that number. It's saddening to think,
Absolutely.
in the
Yes.
space of less than a year, we've lost over 400,000 people to this pandemic, and that's just a big. It's been a big change and a big shift in our lives, and that's data, right?
Yeah.
Uh, and a lot of this deaths, a lot of these infections have been, there's been a lot of it in the community, but we can also not shy away from the fact that it's also been affecting our healthcare workers in a lot of ways as well. Not
Right.
just in terms of the infections, but also how it has affected their loved ones and their lives that they live. The pressures of having to move from whatever station or whatever specialty they're in to be able to figure out how they can best help in
Right.
solving this problem has also been one of the things that we've had to look at so far.
Right.
And in terms of the effects and the status, just generally as well, there's been impact to communities, there's been impact to schools, there's been impact to healthcare practices and hospitals, there's been, issues with patients, and we can get into some of these details, as we continue in the conversations.
Right.
We can't even perhaps put a number to it yet, what this would mean for the health outcomes for 2020, given the fact that a lot of people were unable to access their physicians or be able to even reach them. Some were anxious and reluctant to go to the hospitals. So we
True.
don't even have an idea just yet how
Yeah.
much this would have really impacted health
That's
outcomes
right.
for 2020. So,
That's right.
it's developing. It's been a target that been missing us. It's been going.
Right.
Noticed how those charts, those saddening charts. Sometimes you see them go up, you see them come down. Especially for right now, being right after the holidays, you can see it's been mind blowing how much of an increase we've seen.
Correct.
And there's just so much to keep in mind when we talk about what the state of it is currently. But
Absolutely.
yeah, but one of the good things, one of the ray of hopes that we've had so far in terms of the state of the pandemic currently has
Right.
been the what's it called, the vaccines that have been available now.
Right.
And I think we've had a couple from, Moderna, from which I'm one of the reasons why I'm really glad, it kind of shows us the reason why the pharmaceutical industry is very important in our
Right.
lives currently as well. Um, the fact that people were able to get to work very quickly and be able to help with this. So with Moderna, with Pfizer, a lot of partnership are also ongoing with other pharmaceutical companies, not just in the area of vaccines, but also in therapeutics as well. And
Right.
GSK, where I work, is partnering with different organizations as well to be able to ensure that those types of therapeutics and also vaccines are available. The ones we currently have from Moderna and Pfizer, for instance, they require certain distribution constraints, especially
Right.
in terms of them being at a certain temperature before they are being, they can be viable and useful. But there is still that need to continue to see how we can develop other vaccines that would be able to withstand, normal temperatures, normal room temperatures, and there would be, the distribution would be easier, and it would also be available for lower to middle income countries that might not necessarily have access or the capacity to manage the distribution of the current ones that are available.
Absolutely, absolutely, and I would say that was quite insightful from how you broke it down, because the truth is, I mean, um, this time and period has really devastated a whole lot of community, just like you've mentioned. People have lost lives, and jobs have been impacted, businesses have been impacted in a very, very bad way, and yeah, I mean, and you and I know that this is all this period, of course. Yeah, it's still ongoing. It will be around for a while, but the question is, since we know, maybe some of us probably know that this is probably going to be around for a while. It is to start thinking of how to actually respond to it, how to deal with this thing. Like for instance, I usually have conversations with my colleagues and my coworkers at work sometimes, and in fact, something we actually, we'll talk about in a very serious. And of course, we laugh about it as well. And again, laughing about it is just a way to deal with the mental side of that effect of what he has done. Because I mean, like, people are working from home, different kind of things are happening. So, and of course, some people have different kind of conception about, or what I'd say it's a myth about, okay, do I take the vaccine? What's going to happen and all that? Well, like, my own point is always, look, if you need to take a vaccine, just make sure you just talk to your physician and all that. So again, my question, to a follow-up question just to what you have explained right now, is how do we then get through this era? Having said that, all of the, I will talk about all of the impact and the status of the pandemic as it is. How do we get through this era looking into the future?
Okay, I think, in that prelude to the question, I think you said something that was very, very crucial, which is the psychological and the mental part of the impacts that the pandemic has had on many people. Not even many people, perhaps every one of us. For those that are still very resilient, it's because they are resilient, or it's because they're putting it into consideration.
Correct.
I think it's something that has really affected everyone.
Absolutely.
So to that, and I'm going to pick up from there as where to start from in terms of how do we move forward, or where do we go from here. I think it's very important for us all to recognize and take a moment to reflect on how the pandemic has impacted our lives, from a parent who is unable to send their kids to school and having to juggle both work and child schooling at the same time, to the worker who lost their jobs during this period, to people who have lost their loved ones, and so on. I think the very first thing that we need to have is the conviction that as a human race, we are able to beat this.
Correct.
And to be able to get some level of hope from the fact that scientists are working around the clock, epidemiologists are working around the clock, public health officials are working around the clock, to ensure that this is something that we're able to beat. And communities also, individuals are working around the clock. People have shown up considerably with a lot of humanity during this period in terms of providing food for others who might not be able to have them. There's a lot of talks around landlords giving their tenants a little bit more time, some of it due to the policies that are being done, and some of it just out of their willingness of their heart to do what they feel is right. Make things easier for others. So I think the very first thing is having that hope becomes very, very crucial, because we have to have something that we all can hold on to.
Correct.
The next thing is, of course, this is a big deal, and it's not something that only one person or one part of the community or one part of the nation can hold on to or can fix. It is going to take everyone's attention, everyone's commitment to beating the pandemic. So in every function that you might be, in every situation that you can be, understand the fact that you can play a role in actually making the life of others easier, and your own life as well. We need to have a commitment to making lives easier for us and also for others around us. And that is where we can start to be more, sensitive to the need that we have to be part of the solution. And one of that, there is the vaccines that we all should be very happy. It's definitely a positive, a light in this whole darkness that the pandemic has brought on us. But I feel like the vaccines alone are not going to do it at this point. It's going to take some time for the vaccines to actually prove effective in curbing the pandemic.
Pandemic.
But one of the things that we all have to make sure that we're doing is, out of respect for others, out of love and care for others, we should try as much as possible to continue to use the masks. We should continue to use the mask, the face mask, and try as much as possible to use according to the recommendations that we have. So the cloth masks are fine. The N95 is also an option. The surgical masks are also available. I know that there was a period at the beginning of the pandemic when the surgical masks were not as available. And it was advised then that everyone, if they can, they should use the cloth mask instead, so that the healthcare workers can have access to those N95 and the surgical masks. But now there is a lot of distribution, and if you can, step up from just the cloth mask to the surgical masks if you can. But at least at the minimum, use the cloth mask.
Right.
And one of the things that you might also have been seeing in the news cycle is around double masking. It's around using a filter in addition to your cloth mask. Anything you can do at all, again, even if it's the minimal of just one mask, just go ahead and do it. Anything to help us at all is better than not doing anything.
Right.
So I would advise that, we all continue to do that as a means to saving ourselves, but also out of sensitivity and being able to care for others. Absolutely. The other things, we've talked about this also at the very beginning of the pandemic, is around the social distancing. Sometimes people misinterpret what social distancing really means. But the thing is, it's more of a physical distancing. So as much as you can, stay away from large gatherings, in person, stay away from, just try as much as possible to stay at home if you don't really have any, great reason to be out. If you can order your groceries, if you can, whatever you can do to just make sure that you're not out and about, like the pre-pandemic time, would be really great. So staying at home, if you can work from home, that would be great. If you also can, if you can just limit the number of people that you're interacting with to very few that are also observing the social distancing. But like I was trying to emphasize earlier on, social distancing doesn't mean you can't reach out to people. Try as much as possible, especially for the mental health sake, to stay in contact with people. And you can do that through a phone call, through, Zoom chats, anything at all that keeps you connected to people, that keeps you connected to the community. So you don't feel like you're going through all of these motions alone. I think it would be helpful at this time. So of course, social distance, but also make sure that you're keeping people around you and you're having communications and contact with people as safely as possible. That's another one. And then the third one is around hand washing. Of course, we all know that's an habit that we need to cultivate, not just during this pandemic, but beyond it. It's a good way to just continue to be healthy. And it's not just effective against the COVID-19 virus. It's actually very helpful against other microbes as well that cause a lot of diseases. And outside of what the individuals can do, then we're getting into what businesses can do, and I'm going to elaborate on that a little bit. I think depending on the type of businesses, there is opportunity for you to continue your business just like it's never happened. So for instance, if you're an online business person, it's just normal for you to just continue. But if you're a retailer, for instance, and you have a store, you're a hairdresser, or you have a place where people have to come in, you need to make sure that you're observing the best safety precautions that you can for yourself and your clients. And you please just follow the instructions from the different states around what level of opening they are on, so you can keep your business aligned with the broader communication of the government and how they're planning to open up safely, so you can contribute to that by that as well. The other part is, for pharmaceutical companies, like we were saying earlier on,
Right.
it's not the time to rest our oars, and I'm sure that none of us is resting our oars at this time. We're actually trying our best to continue in the efforts around research and development to be able to get to even better vaccines and easily distributable vaccines that can withstand temperature and the different areas of the world and so on, to be able to make sure that there is equitable distribution of the vaccines. Right now, there's also the cost of those vaccines to put into consideration. It seems right now like it's just available to those who are the highest bidders, who are able to afford it. So we need to get to the point where the supply or the type of vaccines that we're talking about are easily accessible, not just to the high income countries or high income communities, but it's also available to low and middle income communities and countries as well. Then in terms of the governance, I think governance is also another big part of this. I hope that, especially looking at the US as an example, I hope that the different factions or different areas can actually work together. This would require a bipartisan effort to be able to get this under control. And of course, we need to make sure that accurate data, is driving all of the different policies that are being generated and being developed, and that this information is communicated widely and with a lot of sensitivity to what is actually going on currently. There is a way that you can send messages that it draws people in without necessarily blaming or victimizing those that are already going through a lot of trouble with what's going on currently. So I think that tempering messages, making sure the facts are stated, but that they are stated with the sensitivities in mind on how this affects people, will also be very important. So it's not just the sciences, it's not just doing the research, it's not just communicating the facts, but it's communicating the facts with a humane part in it, to ensure that individuals know that they are cared for, and that all of this information is for their own interest as well.
Absolutely. Thank you for that. That was very interesting, and again, because in fact, all of the things people need to do and take into consideration as regards to how they can actually keep themselves safe and keep away from spreading or contacting the virus and all that. I mean, that was really very interesting. But in the midst of all of this items which you have actually listed, as regards on how people can actually get through the era of COVID, by protecting themselves and all that. There's a whole bunch of spread of conspiracy messages, information out there and all that. And in fact, the truth is, I have had series of experiences with different kind of people, friends, and you tell them, look, see, you don't need to infiltrate your mind about a certain virus, but just have a sense of curiosity that this virus actually exists. So how you respond to it, actually drives and amplifies, your safety and kind of precaution you put into place. So my question to that is, I would like that you probably educate us and of course our listeners, and maybe share more insight as to how people should act and respond, when it comes to any kind of spread of conspiracy theory. And in fact, how do you even, pretty much just, tell us how people should actually act and respond to all of these things, because that is also creating a kind of issue, and especially folks outside of the United States, and they tell you, there's no COVID. COVID is meant for, for folks outside of whatever, and it's nothing. We have a different type of COVID. I have actually told a friend before that, look, you're saying COVID, the rate at which it actually spread in the part of the world where you are, it's just different the way it spreads here. I said, look, that's not the point. Believe there is a virus and take self precaution and all that. So I want you to just, share more insight and educate us and our listeners on how to act and respond to this.
Thank you. So, sometimes I wonder what goes up in the minds of those who share, who this misinformation originates from.
Right.
I don't want to be naive about what it could be, but I'm hoping that most of it comes from a place of wanting to help.
Right.
But for someone who wants to help, you have to make sure that you are doing your research appropriately. And doing your research appropriately means understanding that there are experts around some of these pieces and looking for those resources and those channels to be able to help, carve or distribute information that would help people. Right. It's very important for people as authors of some of these messages to understand that there is power in the words that they're sharing. Right. There is power in that video that you're making that is telling people what to do to keep themselves safe from the virus. Right. There is, power in the words that you're using or the videos or the audios that you're making that tells people or give people false hope about how they can cure the virus. The problem is in those messages and in those words, they can easily turn around and become the reason why people die. So perhaps if people who are originating these messages start to think about it that way, that before you put out any information about the virus, understand that it could be what would be responsible for the death of people and for the spread of the infections. That should be something that is at top of your mind before you share any information at all.
Right.
And then ask yourself the question, do you want to be responsible for the death of others by providing misinformation? Right. I think when people start from there, it might be easy for them to understand their role in spreading information that is not accurate. Right. And that's not just for the originators of these messages. That's not just for the creators of this content. It's also the people that continue to share them. I can't count the number. I know I've received a number of those videos and audios and, long line of text, as well.
Right.
And understand that as someone who is actually sharing, you are also responsible.
Correct. Yeah.
So if you do share information that is not accurate and someone has a sense of security that is actually not ingrained in fact, if something should happen to that person or if they don't take the necessary precaution that's actually accurate, you are responsible for whatever happens to them as well, be that being infected with the virus or the fact of actually dying from an infection. Right. So it's very, very important. It's very, very important for us to understand that as conduits of information, we need to be able to, have that, understand that at the other end of this message, at the other end of this forwarded chat, is someone.
Right.
So that is why it's going to be important for everyone to know the places where they can go for sources for information. You talked about the US. I think with the US, there is, I don't know, there is some type of divisive force, especially when it comes to political, sometimes for business interest and economic interest, why people put out certain materials that are actually not accurate. But I believe that, as individuals, we are responsible for ourselves first. Right. So if we also as individuals can go out and look at the resources that actually are trustworthy, do a little bit more research, take a little bit more time to pay attention to what's going on. I
All right.
hope that also as the nation, as we get under the newly elected officials, I hope that we start to develop a better sense of trust, because it's very, very important when the citizens do not feel like they can trust their leaders,
Right.
then it becomes hard for the truth to actually prevail. Then it
Right.
becomes easy for misinformation to spread. So we need to build that trust, especially, health systems also. I think it matters to us to be able to send the right communication to our
Absolutely.
patients. So
Absolutely.
I think there is a lot that hospitals can do. There's a lot that the government can do. There's a lot that governmental agencies and non-governmental agencies, non-profits and all can do to ensure that they're communicating the right information
Information.
to citizens.
Right.
And I think it all also depends on the trust level. So being able to build that trust and being able to communicate effectively, to disseminate the right information
Mission.
at the level that the individuals would understand becomes very crucial.
Correct. Correct.
And then for outside of the country, and I don't know everything that's going on the global scene, but at
Of
least I know
course.
with Nigeria, that one. I can talk
Oh.
about it. So
Nigeria.
I've seen videos of parties. I've just seen things that I'm just like, oh my God, what is happening here?
Yeah.
Okay, so for those that are listening in Nigeria right now, my message is please just understand. And I'll say it in the way that you understand. Understand that COVID-19, it's real.
Real.
It is very, very real. Because
Very.
there's still some people that I still come across some things where people are saying, is it even real or not? It is real. It might be different. The transmission rate might be different in different areas, depending on, the number of infected people and all of that. There's been so much coming out of Nigeria recently.
The whole lot.
And
The whole
it's
lot.
just, it's sad. I've heard so many deaths due to COVID, in the last 30, 40 days than I've heard in the entire year when it comes to Nigeria. And that is to say that this is spreading really fast and so rapidly that there's no reason for anyone at this point to feel like they don't believe that this exists.
Right. Absolutely. Absolutely.
I lost one of my teachers. Actually lost his life. There's about 3 different doctors from College of Medicine, University of Lagos, that have lost their lives recently. One of them was a top neurosurgeon. We don't have a lot of them.
Right.
And this person lost their lives. These people have lost their lives, rather. And it's, we can't just continue to discount this.
Right.
If it's killing healthcare workers, if it's killing head of departments and killing, previous VCs and different, even some of our government officials, we've heard that in Nigeria, we've heard that they've passed away from this pandemic, from this COVID-19 situation, whether the complications of it or, other pieces that are related to it. We need to know and we need to follow the instructions. We need to, pay attention to what's going on around us. We need to understand that for right now, there are definitely steps you can take to boost your immune system. That's general. But there is no specific immune concoction or immune, agbo or agumu or aseje or whatever it is that is going to prevent COVID from getting to you. There is no particular one at this time. That is none.
Sure.
There is none. There is no medication that is known to, like, okay, yes, this is the medication that I will continue to use to prevent me from getting COVID-19. There's not so much of it known yet. Right. Even in developed nations, there's still a lot of research going on. Nobody can say they know everything about COVID-19 at this time.
That's true. That's
true. It is
true.
Still evolving information, and we're still getting to know more about it.
That's true.
So the best bet, again, like I said earlier on, will continue to be those pieces that we talked about. Social gathering at this time, Nigeria, I beg, Nigerians, please. Social gathering at this time, you need to just keep them away. Just play your part. Like I said at the beginning, we just all need to understand that we have a role to play in this. So as individuals, stay away from gatherings. Different states in Nigeria and different, the entire Nigeria would have certain regulations and restrictions about the number of people that can be in a particular gathering at the time. Follow those. I think I've heard 10. I don't know what it is currently. That's why I'm trying to avoid saying, but try and listen out for what the government of your area or the state government or the nation's government is saying. There is the National Center for Disease Control in Nigeria as well, the NCDC, that you can definitely go on their website and be able to get information about what the number of cases are, what the number of deaths are in terms of those that have been reported. But understand that those are reported numbers.
Right.
Numbers of this is actually is much greater than whatever those institutes and those, it's the same thing all over the world. We only know what is reported. We only know what is tested. There are a lot of people who actually have asymptomatic COVID-19. And if they don't get tested, we just don't know. So the best way is for people to continue to put on their masks when they're out and about.
Right.
Try and restrict the amount of out and abouting that you do, actually. If you can stay in your house, work from home, then take that option. If you can, whatever you can do from the house, just try as best as possible to do it. If you have to be outside, use your masks and try as best as possible to wash your hands and sanitize your hands as best as possible. Try your best to do the best that you can, not just for you, but for others in the community and in the society as well. I think it's time that we all get to understand the fact that it takes collective action for us to be able to make a dent and also prevent these infections from spread. Right. So please, if you need information, go to the NCDC. I'm not an NCDC worker or anything, but I know that that's one part that I know in Nigeria that you can get accurate information about.
You can look it up online, Google and all that.
And if you cannot do that, there's the CDC, there is the WHO. Those people, it is their work, it is their job, it is their life concentration to ensure that people get health information. And the information you would get from those bodies would, it would beat any research that you think you want to do by yourself. Correct. Especially if you're not a medical person. You, as a medical person, medically trained person, you might have other websites that you can go to. You might have you might have access to journals, and you can be able to do some meta-analysis of the literature review and all of that. But for the layman, for the people who are not medically oriented and all, some of these bodies are there to help with healthcare information. So utilize them as your source of information. There are a couple of them out there. Again, if you're in Nigeria, the NCDC would be one of the best bet for you. You can look at, I'm sure that some of the health systems and some newer bodies in healthcare in Nigeria would also have those COVID resources that they can direct you to. You can use that. You should also pay attention to radio jingles and all of that I'm sure the government are also doing as a result, as a means of communication for this. But I think it's just very important that we also understand what that individual role is. And that is why I keep emphasizing on that. Each text you send that has wrong information in it for people, you can be responsible for someone else's infection. You can be responsible for somebody else's death. And I don't think you want to have that on yourself. So please be very careful in sharing information with others, especially unverified information, especially information that you can trace back to some of these bodies that I talk about. And also beware of some of those messages that they would send and include WHO as their resource. not all of those who quote not all of those who quote WHO are actually accurate. If you cannot go online to find it and see it on WHO's website by yourself, if you cannot read it on the WHO's website, if you don't hear it from your healthcare providers in your vicinity, in your area, if you don't hear it from the NCDC directly, then do not share that piece of information. I think this needs to be a little bit stern because of the news and information that we've been hearing.
Yeah,
But
yes,
those
yes,
that are,
yes.
corruption has eaten deep into some of this as well. Recently, I was reading something about, people being able to do their testing in Nigeria for 30,000, for 40,000. You guys need to do better.
Right.
This is lives of people, lives of community that are being, this is it's just sad that people can actually buy their way out of COVID testing. That's just unheard of. Because then you put the lives of all of those that are going to be in the same plane with those people, the communities that they're going to from Nigeria, you put everybody at risk. So
Right.
whatever role you're playing as an individual, as an healthcare worker, as an airport staff, as whatever it is that you do, just realize that if it's three things. It's either you're not doing anything at all, or what you're doing is contributing to the spread of the COVID-19 virus, or you're actually helping to mitigate it. You're actually trying, you're helping to stop it. So
Right.
you need to ask yourself really deeply, what am I doing? And if you're not doing anything, you're pretty much also almost doing the same thing, which is spreading.
Right.
So we
Right.
all need to just be on that first part, which is trying our best to do the best that we all can do something. So
Right.
we need to understand that we all can do something. We all can play a role in curbing the pandemic at this time. And we're almost there. We just need to push a little bit further with the vaccines, with the therapeutics. And therapeutics, for those who might not understand, therapeutics is the medication that you use to actually treat the disease. So there are medications out there. A lot of them are new at this time, and there's also been a lot of research for existing medications that can help. I was reading, recently about certain new medications. I don't want to talk about them, so I'm not spreading. Just the same way that I've been trying to caution people. I also try to caution myself not to spread things. Even some of these pharmaceutical companies and some of the some bodies also do this these days, where they've done a research. It's not been published yet. It's not been peer reviewed yet, and they're sharing it through newspapers, and they're sharing it in press releases, and people are hearing about it, and they're thinking that this is accurate. We heard about the whole issue around hydroxychloroquine in the early parts of last year around the pandemic. That's something that we should be very, very careful. The fact that you've done one research, or you've treated 2 people and they seem to be well because you use the particular medication, that doesn't mean that that medication works. For you to be able to say that it works, you need to do your clinical trial. You need to do a randomized control trial. You need to do a case control trial to establish the role of that medication as a treatment, or the vaccine as a vaccine for that particular ailment. You can't just go by your observational data. You just can't go by what you're seeing, or I treat 5 people, and with the 5 people that I treated, this is how it went. That you cannot generalize that for everybody else. So we need to make sure that we're patient with science, and we do the best we can to ensure that we're getting the right information across to the people that really need them the most. I hope that helps.
Yeah. Oh, yeah. Absolutely. That was quite, informative, and thank you for sharing all the insights, as to how people can actually deal with misconception and all of the different kind of, conspiracy theory about COVID-19 or the virus and all, because that's really very important here. I would say to listeners out there, please let us keep safe. Let us follow CDC rule, and for those of us outside of the US, living in Nigeria, anywhere in the world, let's follow and comprehensive information, and always fact check information. Don't just get information and just spread it. Just fact check and make sure it is right, and share the information appropriately. Again, like this is a time and period which is not very easy for anyone, but we will get through this. Let's be patient with our physicians, our doctors, our healthcare workers, and before we end this podcast, so Dr. Bilikis, what last message would you want to say or have for our listeners, out there, and just a last message before we come to an end of the podcast.
I think, it's always an honor to be able to get the chance to express myself like this and be able to contribute, a voice to what is going on. I think as a last message, I would just like to re-emphasize that I hope that we all stay hopeful. No matter what it is that we're going through currently, no matter how hard, and believe me, even as someone who has practiced medicine before, as someone who works in pharmaceuticals currently, as someone who, I would consider that I have access to a lot of information, I still got overwhelmed. I still got, bothered. I still had to do a lot of readjustment. The fact that the fact that you're a physician or you're gainfully employed or anything, it does give you some level of privilege, but it does not totally absolve us from all of the impact. Absolutely. And all of the issues that surround the pandemic. But I want everyone else out there to just know that I hope that you continue to stay positive and you continue to stay hopeful, knowing that the work to actually resolve or to get us to a better place and to beat this pandemic is on the way. We all should continue to have hope that we're going to beat this.
Right.
I think it is one of the beauties of humans and the brains and the talents that we have all over the world, that no matter the challenges that come to us, I think that's one of the key takeaway actually for me in 2020. We understand that there was a problem at hand that seemed so big that we all could not even figure out how to deal with. There was a phase of fear where we were wondering, is this what is going to wipe out the entire population of the world? Is this going to be the end? And all of that. There's always, there's that at the back of people's mind. But with collective effort, with resilience, with persistence, we were able to use existing knowledge that we have about viruses. We're able to use, some of the knowledge that we already have about, pandemics and epidemics. We're able to use the knowledge that we have, the scientific knowledge that we have, to be able to get to this point where we can start to see a light at the end of the tunnel. So I want everyone to understand and also tap into that positivity, into that hopeful message that we can beat this and we will beat this. I hope that everyone would tap into that hope. And I hope everyone would also understand that as an individual, there is something that they can do. There is something that they can contribute. You are not powerless in the face of this pandemic. There is something you can do. And some of the things that you can do are those 3 things that I highlighted earlier on. One is maintaining physical or what we call social distancing, maintaining that as best as possible. Again, look for the regulations for the areas that you are in. I don't want to generalize on that, but if you don't have to gather, don't gather. And if you must gather, follow the limits that has been set by the government in your area. And when you're doing that, make sure you're you're maintaining that distance, that physical distance of about 2 arms length is what they call it, or about the size of a cow. There's been different ways to explain
right.
What that distance might look like. Just try as much as possible to maintain that 6 feet distance in any way.
Sort of face mask as well.
Measure it.
Right.
Wear a mask. Wherever you're outside, with people that are not people that live in your household. Try as much as possible to wear a mask. The cloth mask is fine. Doubling up the mask because of the new variant that is out now is also fine. Including a filter within your mask is also something that you can do. Wearing the surgical mask is also very helpful. The N95 is definitely helpful because that's all of that. So whatever you can do, please wear a mask. Then the third thing is hand washing and sanitization. So the approved sanitizers, make sure you have them with you as best as possible. And whenever you're able to, take a moment out to go and wash your hands as often and frequently as possible. That's something that, as an individual, we can do. But I also want to note that, unless there are limitations, all of this I'm saying generally, but when there is an exception or something, we can also understand. But as an individual, that's a minimum that we all can do.
Absolutely.
And then the third one, because I am a lover of STEM, and I am someone who loves to encourage younger people into STEM, I will take also this opportunity that I hope everyone understands why sciences, technology, engineering, maths, and all of these STEM-related fields are very, very important. It is in the face, it is very crucial in the face of things like this to understand the importance of public health, epidemiology, vaccine development. All of these things take a lot of scientific knowledge. So please encourage your kids, encourage your loved ones. If you're considering it or contemplating it, medicine is something that's very important, that's going to be very crucial. There's an healthcare worker shortage still in the US, even in the face of all of this. And there is a lot of equity piece out of here as well that we also need to put into consideration, where, some people in the lower socioeconomic class are getting hit the most. More communities are hit the most with some of the impacts of this pandemic. So we all should put that in mind. So if I'm going to summarize all of these last pieces, the first one is continue to stay hopeful. Second one is understand what you can do as an individual to help. And then the third part is STEM. Do STEM if you can. So those are the...
All right. Thank you so much, Dr. Bilikis. And hey, listeners, you all have heard everything. Let's stay safe. Let's follow regulations. Let's believe in science. It's very important. And let us all embrace technology as it is, because that's like an amplifier for all of these different things. I know it's not easy. Trust me, you're not alone. And I also want to just use this, last minute to just say a big thank you and a shout out to all our health workers who have been the front line, helping folks who are, trying to survive or gasping for their life, as a result of the pandemic. Thank you all so much. May God bless you all, and thank you for joining, this podcast. As a matter of fact, Dr. Bilikis, I'm definitely going to bring you back on the show. It's been quite insightful and a very insightful information which I've actually shared with us and our entire listeners. And folks, please, once again, let us all be bipartisan in our ways of dealing with this time and period. We will get through this. Let us be hopeful and let us believe and trust, in science, and most importantly, let us also, just keep hope alive. Okay. Thank you very much. And, follow us on Instagram, follow us on Spotify, on YouTube channel at Reconnecting the Dot Podcast. Thank you so much, Dr. Bilikis, and keep safe and stay safe, and see you next time. All right.
Thank you. Bye-bye.
Bye. You have just listened to the Reconnecting the Dots podcast with your host, Abdurrahman. Don't forget to subscribe to our podcast on iTunes or Google Play. And thank you for listening, and see you all next week. Bye-bye.